Most heart attacks don't start in the heart. They start in the blood. Long before chest pain, long before hospital alarms, long before anyone realizes something is wrong, something invisible is already happening inside the bloodstream. Your blood type may quietly influence how thick your blood becomes, how easily clots form, and how aggressively your arteries respond to damage. Most people never think about this. They assume heart attacks come from diet, stress, or age alone. But inside your body, another factor may already be shaping the risk: your blood type. Because different blood types influence the behavior of specific clotting proteins in the bloodstream, and some of those proteins control the exact mechanism that triggers most heart attacks, the moment a clot forms where it shouldn't. Here's the critical detail almost nobody knows. Some blood types naturally carry higher levels of clotting factors circulating in their blood at all times. Others carry lower levels. That difference may sound small, but in cardiovascular biology, even small differences in clotting activity can determine whether a damaged artery slowly heals or suddenly blocks. That blockage is what causes most heart attacks. A clot forms inside a coronary artery. Blood flow stops. Heart muscle begins to die within minutes. But that clot doesn't appear randomly. It forms because a long chain of microscopic biological signals builds up over years. Inflammation damages the artery wall, cholesterol particles get trapped, immune cells accumulate, and eventually a fragile plaque forms. When that plaque ruptures, the body reacts instantly. Clotting proteins rush to the scene, platelets activate, a plug forms. In a healthy repair response, the clot stays small and controlled. But when clotting activity is too aggressive, the plug becomes a blockage. And when that blockage happens inside a coronary artery, the result is a heart attack. This is where blood type enters the picture, because the genes that determine your blood type also influence the levels of specific clotting proteins circulating in your bloodstream. One of the most important is called von Willebrand factor. It acts like biological glue. It helps platelets stick to damaged blood vessels. But higher levels of this protein make clots form faster, and that can dramatically change how the body reacts when an artery becomes unstable. Some blood types naturally carry more of this clotting factor. Others carry significantly less, meaning the exact same arterial plaque could remain stable in one person but trigger a clot in another. And that raises an uncomfortable question. If two people live the same lifestyle, eat the same food, exercise the same amount, and experience the same stress, could their blood type alone change how their heart responds to danger? To understand that, we need to examine how each blood group interacts with clotting biology. Because when researchers compared heart attack risk across blood groups, something surprising appeared. One blood type consistently showed higher clotting activity, one showed moderate risk, one showed mixed behavior, and one blood type appeared to carry the lowest clotting tendency of all. To understand why, we need to examine the physiology behind each blood group. And the differences start with the most common blood type on Earth, type O. Let's begin with the blood type that behaves very differently from the others, type O. At first glance, type O does not look special. It is simply the most common blood type in the world. But inside the bloodstream, something important happens that changes how clotting works. People with type O blood naturally carry lower levels of von Willebrand factor and lower levels of clotting factor 8 circulating in their blood. Those two proteins are essential for forming blood clots. Without them, platelets struggle to stick together and seal damaged vessels quickly. In medicine, extremely low levels of these proteins can cause bleeding disorders, but slightly lower levels create something else: reduced clotting pressure. This means when damage appears inside an artery, the clotting response may be slightly slower and less aggressive, and that difference matters when we talk about heart attacks. Remember what actually causes most heart attacks: not cholesterol alone, not plaque alone.
The final trigger is a blood clot forming on top of a ruptured plaque. If the clot becomes large enough, it blocks the artery completely. Blood stops flowing. Heart muscle begins to die. But when clotting activity is lower, that blockage may be less likely to occur. This is one reason researchers noticed something interesting when studying cardiovascular risk across blood groups. People with blood type O often show slightly lower rates of certain clot-related cardiovascular events compared with other blood types. This does not make type O immune to heart disease. Far from it. Lifestyle still dominates the equation. Smoking, obesity, diabetes, and chronic inflammation can overwhelm any biological advantage. But when researchers isolate blood type alone, the clotting behavior of type O blood often appears less aggressive. In other words, when the body responds to vascular injury, the clotting system may apply less biological pressure, and that may slightly reduce the chance that a damaged artery suddenly becomes blocked. However, the story becomes very different when we examine the other blood groups, because unlike type O, some blood types naturally carry higher baseline levels of clotting proteins. Higher levels mean platelets activate faster, clots form more rapidly, and under certain conditions, that faster response can become dangerous. To understand where that risk begins to rise, we need to look at the next group, blood type A. Because inside type A blood, the clotting environment starts to change in a very important way.
Now we arrive at blood type A, and this is where the biology begins to shift. Unlike type O, people with blood type A typically carry higher levels of von Willebrand factor and clotting factor 8 circulating in their bloodstream. These proteins make the clotting system more responsive. That responsiveness is useful when the body needs to stop bleeding quickly after an injury. But inside the arteries, faster clotting can become a double-edged sword. Because when an artery wall becomes damaged, the clotting system does not distinguish between helpful repair and dangerous blockage. It simply reacts. In blood type A, that reaction may happen more aggressively. When a plaque inside a coronary artery ruptures, platelets rush to the site. Clotting proteins activate. The body attempts to seal the damage. But if that response grows too large, the clot can begin to fill the artery itself. Once blood flow stops, the heart muscle downstream begins to lose oxygen, and within minutes, the damage becomes permanent. Researchers studying cardiovascular patterns across blood groups have repeatedly noticed that non-O blood types, especially type A, tend to show slightly higher rates of certain clot-related cardiovascular events. One reason may be the elevated baseline levels of clotting proteins circulating in the bloodstream. Those proteins essentially prime the clotting system. They make it easier for platelets to stick together when damage occurs. This does not mean a person with blood type A is destined to develop heart disease. Genetics alone rarely determines the outcome. But the environment inside the bloodstream can influence how the body reacts when something goes wrong. Think of it as a system already prepared to act quickly. When arteries remain healthy, that responsiveness may never become a problem. But when inflammation, cholesterol deposits, or long-term metabolic stress weaken the artery wall, the clotting system may respond with greater intensity. That intensity can turn a small rupture into a full blockage. And this is why blood type A often appears in the middle of the cardiovascular risk spectrum. Not the highest risk, but also not the lowest. The next blood type, however, introduces a slightly different pattern, because type B blood carries a clotting profile that behaves differently again. And in some studies, its cardiovascular behavior becomes harder to predict. To understand why, we need to examine how blood type B interacts with inflammation, platelet activity, and vascular repair.
Now we arrive at the final two blood types, type B and type AB. Both belong to the group known as non-O blood types, which means they typically carry higher baseline levels of key clotting proteins compared with type O. But their cardiovascular patterns are not identical. Blood type B sits somewhere between type A and type O in many physiological responses. People with type B blood still tend to have elevated von Willebrand factor levels compared with type O, which means the clotting system can activate more easily. However, some studies suggest that type B may show slightly different inflammatory patterns than type A. Inflammation plays a crucial role in heart attacks. It weakens artery walls, it destabilizes plaques, and it creates the conditions that allow a clot to form suddenly. When inflammation and clotting activity combine, the risk environment inside the arteries becomes much more unstable. In blood type B, researchers often see moderate cardiovascular behavior, not the lowest risk, but not consistently the highest either. That brings us to the rarest blood group, type AB. AB blood combines characteristics from both A and B blood groups, and that combination creates a unique clotting environment. People with type AB often carry some of the highest circulating levels of von Willebrand factor among all blood groups. Higher clotting protein levels mean platelets can attach more rapidly when vascular damage occurs. That faster response can be beneficial in injury situations, but inside arteries affected by plaque buildup, it may increase the chance that a clot grows large enough to block blood flow. Because heart attacks do not occur simply because plaque exists. They occur when plaque rupture triggers a clotting cascade that becomes too aggressive. And in individuals with stronger clotting responses, that cascade may accelerate more quickly. When researchers compare cardiovascular patterns across blood groups, a general trend often appears. Type O tends to show the lowest clotting tendency. Types A and B show moderate elevation, and type AB frequently appears among the highest clotting environments. But none of these categories guarantee a heart attack. Blood type is only one variable in a much larger system. Lifestyle, metabolic health, inflammation levels, blood pressure, and insulin resistance all shape cardiovascular risk far more strongly. Your blood type may influence the environment inside your bloodstream, but the daily signals you send your body still determine how that environment behaves, and that means heart health is never decided by genetics alone.